a hospital in a sorry state of affairs. The report confirmed pregnant women sleeping on the floor and on the chairs, collapsing infrastructure and staff shortages, overcrowding, breaching of infection prevention and control protocols by using a solution not recommended to clean the skin before operations, leading to wound infections in 11 patients. But the public has reacted with mixed emotions.
It's faulty in this hospital. They need to do something, especially in the maternity area.
I can say nothing negative. Beautifully and clean. The doctors were professional. I've got no negative there.
I mean, amanesi awafani now. Kukhona a rights, kukhona ngekho rights. So I wouldn't put a blame on everyone. Ngithi wonke umuntu akekho rights.
You have to lay on the floor and you've been treated so badly at the end of the day. So what respect do you have as a human being? And if you go and complain to the nurses or whoever, what can we do? It's the way we have to live.
The appalling conditions were first exposed by whistleblowers like Dr. Tim Meyer, who advocated for patient safety and provision of quality health service. The DA in the province, however, says it will request the South African Human Rights Commission to investigate the inhumane conditions.
What is worrisome is the Gauteng Department of Health's lax attitude when approached for intervention at Rahima Moosa Mother and Child Hospital is a stark reminder of the difference, between promise and implementation by the ANC government. The inhumane conditions of Rahima Moosa Mother and Child Hospital, would be much more magnified. I would say magnified tenfold should the ANC manage to bulldoze the unconstitutional National Health Insurance Bill through Parliament. I think it needs to be clear that we need to get the basics right first, and that is where the starting point needs to be. That is where monies need to be allocated.
Professor Malachapuru recommended the transfer of hospital CEO Dr. Mkabai and the appointment of a suitable CEO within 3 months. He also recommended the hospital to be refurbished within 6 months. The provincial government says it will act on the recommendations of the ombudsman.
We are going to make sure that we have our implementation plan, short-term and long-term. Then we will immediately get into those low-hanging fruits that we should be doing. Then the other process, or the long-term process, will definitely make sure that we do that plan parallel with this one, so that because we don't have time in correcting some of the things that are happening in our institution, including other institutions in the province.
The DA says it will monitor the implementation of the Ombuds's recommendations. Mulimone Muto, SABC News, Westbury.